Hello and welcome to the PharmAssist virtual learning experience. We are very excited to have you here tonight. And before we get started, I just want to begin with a quick disclaimer. The disclaimer is the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to welcome you again to tonight's installment of the PharmAssist virtual learning experience. It's an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. While the PharmAssist program takes place every Monday at 7 p.m. Eastern Standard Time and is oftentimes it's a live presentation that you can join in and ask questions, we are doing something a little bit different tonight. So tonight what we wanted to do was put together a collection and have all four of our nurses from the first month of this program do one of the products throughout the course of this presentation tonight. So what you're going to hear are those first presentations that they did, and you'll get to hear the Q&A that was involved, and all of this will be put together where you can listen to it online as always. So we are going to be joined by a number of great speakers tonight, and you will get a chance to be introduced to each one of them as we go. The whole goal of this is to really make you feel as if you're sitting right across the table from them in the clinic. So we want this to be as smooth and easy as possible. And have no fear, you can add any questions into the Facebook channel as well, and we will get back to those even though it's not a live program tonight. So you can join us via Zoom or Facebook Live. We can be a part of the presentation and the program, but for tonight, just take a seat, strap in and listen to some great conversations on four excellent products from four incredible speakers from the PharmAssist program. Thank you very much and enjoy tonight.
You have been prescribed to take HCG by your healthcare provider. You should have been told a specific time to take this medicine because this does the final maturation of your eggs to prepare them for either ovulation or egg retrieval. It's actually quite simple to do this. There are a couple of routes of administration you can do this. Your healthcare provider will tell you whether or not to take this injection directly in the muscle or just into subcutaneous fat. So we'll go through both those ways. If you've been prescribed to take this medicine just subcutaneously, then that should be given in the area beneath your belly button and out to the side or in your outer thigh. To do that, you just bunch up a little bit of tissue and put the needle straight in. If you've been prescribed to take this medication intramuscularly, it should go in the muscle of your hip. To do this, just put your hand on your hip bone, and way up in the upper outer quadrant is where you'll give this injection. And you can see in this picture, it's the upper outer quadrant. Your nurse or healthcare provider will be happy to point out exactly where you should give this medication and whether you should take it intramuscularly or subcutaneously. To mix a medication, it's actually quite simple. You'll need the contents of the box of the HCG, which will have a vial that has liquid and a vial that has a little bit of powder in there. It may actually look like a little cake. Next, you'll need a syringe to mix the medication and to draw it up for injection. Start by removing the cap from each bottle, just by lifting it up. The powder and the liquid, just lifting it up to remove it. Next, open this package that has the syringe and the attached needle, and then remove the top from the needle just by pulling it straight off. Next, take the tip of the needle and insert it into the middle of the rubber part of the vial. You'll want to be able to see the needle in the liquid. Although there are 10 cc's of liquid in the bottle, you're really only going to need about 1 cc. The exact amount of liquid doesn't really matter. The liquid is simply to dissolve the powder. I generally tell patients to withdraw 1 cc. And you do that by just gently pulling back, making sure that the needle can be seen in the liquid, If you have a little air in there, that's okay. Then take it out. Just push straight up to make any air bubbles come out. And then take the bottle of powder and insert the needle into the same place at the top of the vial. Push in all of the liquid, and the powder should dissolve pretty instantly. If necessary, you can just swirl it around a little bit and it dissolves very quickly. Then turn the vial upside down, again making sure you can see the tip of the needle in the fluid, and withdraw all of that mixture. And remove the needle from the vial. If you've been told to take this medication intramuscularly, it's ready to give. The needle's already on. You just simply need to choose your injection site. If it's going to go in the muscle, it'll be this needle. You separate the tissue so that it'll go deep into the muscle. One wipe with alcohol, and then put the needle straight in all the way. Pull back on the plunger just a little bit. You're probably going to get a little bit of air back. That's completely normal. If you get blood, just pull back just a tiny bit on the needle and go ahead and push the medication in. And then pull the needle out straight, all the way out. If you have a little drop of fluid or a little drop of blood, that's completely normal. Just wipe it with an alcohol pad, and you can apply a bandage if necessary. Then you can carefully recap the needle, remove it, and place it into a sharps container just to avoid any injury later on. If the medication has been prescribed for you to take subcutaneously, choose the injection site and change and put on one of the smaller needles that will be prescribed that will be sent to you with your medications. The needle will just similarly screw right on the tip of the syringe. Choose your injection site, wipe it just once with a little bit of alcohol, bunch up the tissue, and take the needle, put it straight in all the way, inject the medicine, release the plunger, pull it straight back all the way. Recap the needle and place the needle and syringe directly into your sharps container. Congratulations, you've now reconstituted and administered your HCG injection. So how easy was that? I'm happy to answer any questions you have about HCG. Actually, that's probably the medication that I get the most phone calls about, because the bottle that has the liquid in it has 10 cc's of liquid, and you only need to use 1 cc of liquid to dissolve it. So don't get too overzealous and put in all that liquid, because that would be too much to take in one shot. You may be taking 3 or 4 shots if you do that. So it's just 1 cc of liquid into all the powder, and take that mixture. The medicine is in the powder. The liquid is simply just something to dissolve the powder. There are other medical indications that people take HCG for, and they may take a much lower dosage. So 1 cc of liquid into all the powder.
Perfect. Thank you very much, Karen. So a couple questions coming in. Speaking of, like you just said, regarding dosage, there was a question that said, the last HCG I used had a lot of powder, and this Pregnal looks like very little powder. Is there still 10,000 units in the powder?
Great question. Different manufacturers, the medication looks a little bit different. So some brands, it looks like just almost just like a few flakes of powder, a very small amount. Where others look like a little cake that goes not quite an eighth of the way up the bottle. So it looks like a whole lot more. But it's the same dosage. There are 2 dosages of HCG. One brand called Novarel comes in 5,000 units. So the whole thing of powder is 5,000 units. Or you can get a 10,000 unit of Novarel. The other manufacturers, they're all 10,000 units. So your provider will tell you which strength you need, either 5 or 10,000 units, and prescribe your brand likely based on that. But it doesn't matter how much or how little powder it looks in there. the amount that's in there will be correct for the dosage that's on the bottle.
Perfect, thank you. And actually, a bit of a follow-up question that came in that just said, you mentioned the two different that dosages that are available, but a question just saying, in general, I just hear HCG kind of mentioned interchangeably. Are there any other tangible differences between the different brands?
There really aren't, other than the different dosages of 5,000 or 10,000 units. There's also a recombinant HCG called Avadril that will feature on an upcoming PharmAssist program that's a little bit different, but really HCG is HCG, and I think whatever your healthcare provider has recommended for you is the one that he or she feels will be best for you. And so I would just go with what they say. One of them is not going to hurt more or less than the other. I will say most people say the HCG does not hurt when you give it, but sometimes if you give it sub-Q, you can notice a little bit of redness afterwards. Maybe not till even a day afterwards. That may last for 2 or 3 days. It look like you've had a mosquito bite. That's completely normal too. In my experience, I found that about 30% of women will have like a little tiny local reaction when they take HCG subcutaneously. If you have that happen, doesn't mean that it ever happened again. If you have to take it again at some point in the future, you still just got the same 30% or so chance that that would happen. Otherwise, there's not really a difference in the brands.
Thank you very much for clarifying that. That's perfect. And another thing, a little bit about some of the differences. You talked through the different types of needles that were available, and a question just came through that said, my Novarel came with a small diabetic needle for mix and injection, though I thought I was supposed to inject with a much bigger needle. Can I use an 18 gauge that I already have?
Oh, you don't want to do that. Have you seen what an 18 gauge needle looks like? It looks like a nail. You definitely don't want to give yourself an injection with that. I have had some husbands that have done that for their spouses, and once the wife realizes that that's what's been done, there's been a little bit of discussion following. So I would not recommend you use an 18 gauge. If you're told to take HCG subcutaneously, it's perfectly fine to give it with a TB syringe or an insulin syringe that was provided. That's perfectly fine. In general, the pharmacist will send you a 3 cc syringe to give that, sometimes a 1 cc. But as long as you take the medicine, as long as you dissolve the medicine in the liquid, it doesn't really matter which needle that you use. If it's sub-Q, you want a short needle, about a 1/2 inch or so, or maybe even a little bit bigger, a little bit smaller. You never want to do a sub-Q injection with an 1.5 inch long needle. If you've got an 1.5 inch long needle, that's going to be to put into the muscle. And then you want to avoid taking an injection with an 18 gauge needle.
Thank you very much. Okay, so we had a question that came in. So you talked a little bit about the difference with the powder versus kind of the cake, and so there's obviously a little bit of confusion that we just want to clear up. Where
Okay.
a question that says, you said that it's a powder, but when I received it, it was all clumped together and it looked just like a solid tablet completely. Is this okay, or is there something wrong with my injection?
There's nothing wrong with it at all. It can settle and form like a little cake, or it can be disrupted in transport and look more like powder that moves around. The brands vary just a little bit. So some of them look like they have a little or a little bit, just a teeny bit, and some look like a little bit more. And how much the cake or the powder has clumped together can be varying with brands, as well as to how much it's been agitated, so to speak. So don't worry about that. It's just like with the Menopur. Sometimes it'll look like a little cake, but if you were to take it and shake it up, even when it's just the powder, it'll dislodge it some. No need to do that. No need to worry about it. As soon as you put the liquid in, it's going to dissolve pretty instantly. Great question. It's always good to take a look at your medicine when you first receive it. So when you get the box in the mail from the pharmacist or from the courier, when you get it in the mail, you want to open it up, see what's in there, see what kind of treats Mandel's may have put in there for you. And kind of think about what your calendar says, what your prescriber has instructed you to do, and get a general idea about how you want to organize it best for yourself. Then every step of the way is you're just going to realize how much easier it becomes. I see patients all the time pre-social distancing where one person would say, oh, I took these medicines and it's really easy, you're not going to have a problem with it, here's the trick to it. And talk with your friends, talk with people in the waiting room, and certainly talk with your healthcare provider, because we want to tell you all the little tricks of the trade to make this as easy as possible, because we want this to be a positive experience for you. Nobody wants to be faced with infertility. Nobody wants to have to go through infertility treatment, but we are here for you and we want to make it as easy as we possibly can.
Thank you very much, Karen. One quick thing, I did want to just tack on to that, as you mentioned, any questions obviously that you guys may have about either whether it's the injection itself, the syringe, about the way your medication looks. Always, know that you can always go back and reach out to your prescriber as well. Like you said, Karen, those are things that, yes, we can help as much as we can here, but specifically you want to make sure that you're touching base with your prescriber if you do have questions about the medication, as opposed to just relying on the PharmAssist program to point you in the right direction. So just wanted to make sure we said that. A couple of questions, and these are kind of all building on each other. So we'll make sure I get to this. It says, I was told to wash my hands and clean the area that I'm going to work on. Is it okay to use a soapy cleanser, or do I need to use antiseptic soap to wash my hands?
We hear a lot about hand washing these days, don't we? You should always have a clean work surface and clean hands when you're going to do this, and not touch anything that is going to come in contact with a needle. So it's fine to use soap. It's fine to use hand sanitizer, whatever you like. I personally think soap and water is the best cleaner. So just wash your hands with soap and water. Wipe off the area, your workspace that you're going to use to reconstitute the medicine if needed, to prepare the medication for injection. It's important when you have to reconstitute the medicine, you don't want to touch the rubber insert of the vials, and you don't want to touch the needles directly. So you don't want to touch anything that's going to come in contact with you. Keep everything as clean as possible. But don't fret too much over making a sterile environment. No matter how much we wipe our skin with alcohol, it's not going to be sterile. You don't have to scrub it down with alcohol. You don't have to scrub down the site you're going to give it. Just wipe off a work surface and wash your hands, and you're ready to go.
Perfect. Thank you very much. And then this next one comes, it sounds like something that it could have been something I could have done, so I apologize in advance, but it says, my sweet husband opened the package this morning and he left the refrigerated products on the kitchen counter for hours. Is it okay that the meds were at room temperature for that long?
Yeah, don't be too mad at him over that. The medications that have to be refrigerated, not all of them do, but the ones that have to be refrigerated should be refrigerated fairly promptly after you receive them. They'll come in like a little refrigeration pack in with the medication. But don't be too hard on that guy, because he had good intentions. At least he was nice enough to open up the box and take stuff out. So give him praise where you can. But it's all really pretty forgiving. The package insert probably doesn't say this. It says refrigerate immediately and keep it refrigerated until it's ready to give. However, if you're going to give it within 30 days, it doesn't matter anyway. This is just for storage, for longer term storage, that it has to be refrigerated. So if you get it and you start your medication tomorrow, it never has to go in the refrigerator. If you get it, you're going to start it in a week, it doesn't need to go in the refrigerator. And once you've mixed it or once you've used it, it doesn't have to go back in the refrigerator. You want to give these medications when they're at room temperature. That's when it's going to be most comfortable to give them. So don't be too hard on them. I think they're going to be just fine.
Now we're going to review how to do an Avodrel subcutaneous trigger shot. Now the shot will come in a box that looks like this. It's all pre-filled, ready to go for you. No mixing, the needle's ready. So this is generally just how to do a subcutaneous shot. So you'll need your supplies, you'll need your injection, so you can see it here. You also need your alcohol prep pad, and that's it. So since the shot is ready to go for you, really what you need to do is select your site for injection. Now, subcutaneous injections can be done in multiple places. I would confirm with your healthcare provider where they want you to inject. Generally, I recommend either the abdomen or the thigh tissue. Really anywhere that you can pinch an inch of skin is fair game. I think most of my patients end up doing the abdomen, but it's up to you. So once you have chosen your site, you will open your alcohol prep pad, clean the area, let the alcohol dry, and you will take your injection, take the cap off, and you will see the needle there. Now, if there's a little bit of air in there, you can always press it up to get rid of it. Otherwise, it's pretty much pre-filled for you. Then you will pinch an inch of skin, so that area that you prepped, pinch that inch in fast, 90 degrees like a dart. Press the plunger. Hold it for a few seconds, then remove. At this point, this can go straight into your sharps container. No need to recap it to risk sticking yourself. And you've completed your Avidrel trigger injection. So that was the Avidrel trigger shot. That one is pretty straightforward. It's nice you don't have to do any mixing. It's pre-filled, ready to go. So if anyone has any questions about Avidrel, we can start those now.
Great, Caitlin. So we did get one question that came in that says, I received my Avidrel last Thursday, but I unfortunately did not refrigerate it before leaving for the weekend. Do I need a replacement?
So it depends on when your plan is to take the trigger shot. So if the Avidrel is at room temperature, it is good for 30 days. So if you are actively cycling and you will be taking it within 30 days of when it hit room temperature, then it is perfectly fine to use. If it will be more than 30 days, you should get a new one. I typically tell my patients, as soon as you get it, put it in the refrigerator, you know that it will be good until the expiration date on the box, just to be safe.
Perfect. Thank you very much. All right. Sounds good. So another question that just came in that said, I know you specifically mentioned that you could give the shot anywhere, but just to be sure, can I inject it into my arm? I'm not a big fan of injecting in the belly.
Yes, you can. So the three areas that I typically recommend is, like I said in the video, the belly, and that's probably the most popular site that my patients use. The tops of the thighs are okay. You can also do the arm. If you're doing it in the arm, I would suggest going kind of around the back side of the arm where you can pinch a little bit more of the skin up. Anywhere that you can pinch an inch, just make sure it's that fatty tissue that you're pulling up to the top. And any of that is perfectly fine to inject in the arm.
Great. Thank you very much. All right. And feel free again, anyone, you can put in any questions into either whether you're joining on Facebook or in Zoom. Anyway, it'll get to us and we'll definitely get a chance to answer your questions. Speaking of which, this one just came in. Somebody said, okay, I think there's a bubble in my Avidrel vial, but I'm not sure. In my Avidrel, but I'm not sure. Do I have to take it out?
A little bit of air is not going to hurt anything. I know that the movies kind of make any air in a syringe that's being injected seem super scary, especially with subcutaneous injections. You are not putting this into a vein. If there's a lot of air, I would at least press it up. But if there's a small bubbles, they're perfectly fine. You can leave them. They're not going to hurt anything. A lot of my patients just like the peace of mind that all of the air is out. So if you choose to get rid of the bubble that may be in there, you can, and I actually have one here, you can kind of flick the syringe to make it rise to the top, press your plunger up until you see a few bubbles come out of the end. Then you know it's completely primed, but a few bubbles are not going to hurt anything in fatty tissue.
That's great. Perfect. Hopefully we're putting a lot of people at ease right now. It seems like most of the questions are coming in about things people get a little bit nervous about. So it's great that we can calm them down and know this is not as hard as you think. So this one is
Definitely.
a little bit more of an overarching, just kind of educational question. So I think maybe you can dive a little bit into this one, but I think there's a little bit of confusion about the name because it says, I hear it's always called the trigger shot, but what do we actually mean by trigger?
Yes. So this is a common question I get from patients, especially patients that are new to treatment. We all get so used to just saying your trigger shot. We call it the trigger shot because it actually triggers ovulation. So throughout a cycle, when the follicles are developing, there are eggs inside the follicles. As they're growing and maturing, the eggs actually stick to the wall of the follicle. And the trigger shot essentially triggers ovulation, meaning that it causes the egg to release from the follicle wall, and then it free floats in the follicle before eventually being released completely from the follicle to then be fertilized.
Great. Thank you for that in-depth explanation. Hopefully that clears up some of that for everybody. We are waiting. We have any other questions? Feel free again to jump in and share them. But in the meantime, I know it takes people some time maybe to process everything and come up with their questions, get them into the chat. So kick it back. Caitlin, is there anything else you want to share as we give people a couple more minutes on the Q&A section?
Yeah, this one is one, and it varies from clinic to clinic, but where I work, this is one where those that are a little bit newer to treatment, this might be one of the very first injections that they have to do. So it's nice that it's pre-filled, ready to go for you. It's a good one to do as kind of a confidence boost. Like I said at the beginning, after you do it the first time, you'll look back and it'll be a piece of cake. You'll be a pro after you do it for the first time.
Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menopur. Menopur comes in little powders, and we're going to use our imagination and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menopur. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menopur. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menopur and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of air, drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. Any questions you have about Menopur? Any questions coming in, Craig?
Yes, so we have one here about the mixing. Can I use more or less than the 1 ml of the saline to mix the Menopur, or does it have to just be the 1 ml?
Good question. So if you're using one powder, if you would like to use 1/2 of a milliliter, that's perfectly fine. That's enough to mix the one powder. We recommend using 1 milliliter for any amount up to 4 powders at our clinic. If you have more than 4 powders, which is highly unlikely, you can use a little more liquid. However, the way to minimize the pain with this is to just give this shot very slowly. If you use you can use up to 2 milliliters of liquid if you want, but the more liquid you use, I think the more painful you're going to find that it is. So the key is to give this one very slowly, because this one does tend to sting a little bit.
Okay, thank you. Yeah, that actually came in. You just answered a second question came in that was about if I use more or less. I heard from a friend that I can use more or less liquid to inject to make it less painful. Is that something you've seen before? So you did just touch on that. That's very helpful for people to know that the more liquid could actually cause that. So good to know. This other question just came in. We've seen this one before as well. My Menopur vial looks more like a solid tablet or a pill, an actual pill, than a powder. Is this okay?
Yes, the Menopur typically looks like a compacted disc of powder, like a little tablet in the base, and that's perfectly fine. If it looks just like loose powder, that's okay too.
Okay, sounds good. And then somebody was asking here, do I have to use the Q-cap? I have both the long and short needle for it. Does it matter if I mix with one of the needles or the Q-cap itself?
You don't have to use the Q-cap. It's a really nice needleless mixing device, so it decreases your risk for getting poked. But if you prefer to use a needle to mix it, that's perfectly fine. You would just put your mixing needle on the syringe first, pull up your 1 milliliter of liquid, put it into the powder, draw it back into the syringe, and keep repeating that process until you have the right number of powders dissolved and back into your syringe. And then you would switch over to the little needle, point it at the ceiling, get rid of the air, and then you can give that in the belly.
Thank you very much. Okay, I appreciate it. So as of right now, we have no other questions that have come in yet. Again, if you have any questions at this point about any one of the 3 products, the Gonal-f Multidose, the progesterone in oil, the Menopur, feel free. You can hop into the Q&A section of the Zoom if you're on there, as well as also you can jump in to the Facebook Live where we have a chat going, and you can put in any questions you may have there as well. But as we give people some time, just in case, we've had quite a few questions came in today. So I do want to throw it back over to you, Laurel, just in case you have anything else you want to share, anything else you want to last minute information you want to share with the group who have joined in tonight.
Well, I do want to encourage everybody to just hang in there. I know that it's intimidating to give yourself a shot, or the brain tells you that you shouldn't hurt yourself. And there's this very strong pull, this urge not to give yourself a shot. But just know that if there's a greater good here, and just overcome that fear. And you will find once you've given your first shot that it's not nearly as difficult as you imagined.
This video is to help you with the multi-dose Gonal-F with mixing and administration. If you've been prescribed multi-dose Gonal-F, Gonal-F is an FSH product, follicle stimulating hormone. So you're taking that product to actually stimulate the ovaries to produce multiple follicles, which in turn produces multiple eggs, preparing you potentially for egg retrieval or for even an intrauterine insemination. So it's just good to know why you're taking something, because I think that's the first big thing to know. So that's the reason, is that it's going to help you produce multiple eggs. Next thing is, how is this medication administered? This medication is a subcutaneous injection. Sometimes nurses will say it's in the fatty tissue, so that's correct too. So to keep it a little less clinical is to say that it's a little subcutaneous injection using a small needle that's going to go in your lower abdomen, lower belly, or your upper top or outer side thigh area. That's strategically where we usually have our patients at our clinic, and I think most patients at the clinics are doing it, that injection in those areas. But again, you would always contact your clinic, your nurse, your team, just for verification, and they will always review with you your dosage and the injection technique and the area to inject. Lastly is this medication, because it is in the subcutaneous or fatty tissue, you could self-inject. So think of insulin when patients before pumps were administering a medication that was needed to be learned by them. Oftentimes diabetics know how to do their own injections. So this is kind of like that. The difference between that is that for diabetes, that's for their lifetime. For your window of fertility, there is a beginning and an end to the injection during the cycle. So I want you to know that. It's just to realize that with each of these medications that we will review or sometimes have you taking, there's always a starting point and there's always an ending point. And there'll just be a brief period of time that you might be taking it to help the action of what that drug's to do. So next step is your supplies that are needed for this medication are going to be your multi-dose kit. You may have a smaller box than this from the pharmacy, but this is a little demonstration kit of mine, but you will have a box similar to that. And in that kit, what you will have is 1 vial of powder. So the medication of multi-dose comes in a vial, but it is in powdered form. And a lot of times the nurses call it a powder, a tablet, a wafer. There's no wrong way to say that. There's just many different ways to say the same thing. So that's what you want, is that 1 vial. Know that that's the medication, is that 1 vial. And it's a multi-dose. We'll talk about that a little more. The other thing that you will need is 1 pre-filled syringe that is provided in your packet. You have a pre-filled syringe that is provided with sterile water, bacteriostatic water, and that's going to help to dissolve the powder that is in that vial. And then you will have 1 Gonal-F, 1 milliliter, 1 cc, and it does have attached to this one a 27 gauge half-inch needle. And there'll be multiple of these because you're doing that injection for more than 1 day typically. On average, just to put it out there, sometimes anywhere between 7 to 10 days that you might be taking this. Could be a little more than 10 days, but on average, 7 to 10 days of an injection of multi-dose. And so the supplies you need is, finishing it off is this injection syringe, which is a Gonal-F 1 milliliter syringe, but it also has the appropriate size little needle for the type of shot that we are going to do. So as with all the videos or anytime I'm showing mixing of medications, I always remind you that it's not sterile technique, but it's clean technique. So what you want to do is just always good to wash your hands. For sake of the demonstration, I'll take a little bit of hand sanitizer, but mixing medications is not a sterile technique. It's just that it's a clean technique. So it's always good to have clean hands after you've gathered your supplies. Clean those hands, if you will. First step that we're going to take is take that multi-dose vial, and in here for the simulation of this video, there isn't a powdered pellet in here, but you would have a little powdered tablet in here. When you have that tablet, you're going to uncap and hear a little click, and then what you do is, remember I do say in other videos that this is sterile under there, but it's the nurse in me to always wipe the top of that vial with a little alcohol wipe, because any surface that I'm poking with a needle, I always want it to be clean. So that's the reason I'm cleaning the top of the vial. If you ever forget that step, it's okay. Don't panic. It's perfectly fine. It's just, it's something that when you have a multi-dose vial, I want you to get in the habit, because each night you will be utilizing the same vial for your medication or your injection. And so it's very good because it'll be open to the air. That's just good to always clean that top. Okay, clean it with that little alcohol pad, or like I said, you can have your little rubbing alcohol and a cotton ball doused in alcohol just to rub that top of that vial. Then our next step is to take the injection pre-filled sterile water and uncap that needle. And what you're going to do is poke that needle through the center of that vial where there's a rubber stopper, and you're going to gently push the solution of that water, and do it gently, because the vial will have little bits of bubbles. It may actually, with that powder in there, it's going to be a little cloudy at first, but what you want to know is it's going to clear up. Sometimes what I tell patients is once you've injected that fluid into that vial, then you can remove the syringe, but then gently roll the vial. You don't have to shake it vigorously. You don't want to create a lot of bubbles. You're just kind of gently rolling, because you want to get all that little powder that's in there to dissolve with the water that you're being supplied. Now, the biggest thing that somebody might ask is, how long will this vial last me? That's a difficult question for me to answer for you with showing mixing administration. And the reason that's difficult is that I don't know your dosage. Your physician and your nurse will be developing a plan of your dosage. And so somebody who might be taking a smaller dosage each evening of this product, or each day, I should say, no matter what time of day you're taking it, your clinic will advise you. It may last you more days than someone that is taking a little bit of a higher dosage. So remember that your dosage is tailor-made to you based on your age, your diagnosis, and your history. And your doctor comes up with that plan. But for everybody that uses multi-dose vial, there is typically more than one injection in here. So that's what you just want to know, is once it's empty, you'll know, because you won't be able to draw out any more of that medication. So in the very first night, it's nice and full. And then what you do is you take your needle that says 1 ml syringe, 27G ½ inch, and you open it from its package. It's sterile in there. And with live TV, I've just actually bent the needle a little bit, so I'm going to actually put that down. See, even for me, things like that happen. And that's perfectly okay. I could feel myself bending that needle because it's very fine. So if that ever happens, I'm going to put that in the sharps container, but let me try again. See, it doesn't matter. Even you can have that happen, but even I can have it happen, so don't worry. So I'm taking out a brand new needle and syringe. And what I'm going to do is let you see that this is calibrated in international units of the drug. So meaning that when your nurse gives you your number, that's what she's referring to, is the number of units for that medication that you're going to draw up. So I'm going to use the example of if I'm drawing up 150, which this is the little 150 line. So what I'm doing is I'm drawing down, and the top of the plunger I'm placing on the 150, and I'm going to inject a little air. Because whatever amount of liquid that I'm drawing out, if I'm going to draw out 150 units, I want to equalize a little bit of the pressure that's in the vial. It just makes it a little easier if you draw up that air. It's not incorrect if you don't. It's just a little step that can help make it easier, so never panic if you don't do this, okay? But I just find that it helps it a little bit, make it a little easier to draw up. So you would insert that needle into the vial, right in the center. Oh my goodness. Hold on just a sec. There we go. Okay. Insert that right into the center and then turn it upside down, and then you inject a little bit of air in there. That helps to sort of equalize things a little bit. And it's actually pushing down on the plunger for me right now because of that pressure. So I'll let it do its thing. But then eventually what I'm going to do is I want to gather the amount that I want, which is 150. So once I get it to the 150, I'm going to turn it right side up, and I'm going to remove that needle. A little bit squirted out because I had a little pressure there, but just so that you know, sometimes that will happen. It's not a wrong thing if a little bit squirts out. It just means you're losing a little bit of the drug, but it can happen even to those of us working with the medication, just so that you know. So if that ever happens, just go with it. You still have lots of nice medication in here, okay? Your next step will be that you're going to cap this needle until we're ready to inject. Just gently cap it. And where I'm going to see that I have a few bubbles, air is not an issue going into fatty tissue, but sometimes some of the clinics and nurses may recommend that you give a little tap if you see any little air bubbles, because it just helps to let that air rise to the top, and then it won't be as part of your shot. But don't feel worried if you can't get rid of an air bubble, and there are many times you can't. Just let it be. The important thing to know is that this is not going anywhere near a vein, and that is when air is an issue, when it's near in a vein. This is going into your belly and your upper thigh area, so it's a little fatty tissue shot, so you do not need to worry about that air. Where it is that you're going to administer, I'm going to get my little mannequin here just to show you that you are going to give the injection. It's going to be in either the lower belly, okay, or the upper thigh area and side outer thigh area. No area is better or more efficient or more effective. The little fatty area in here is fine for this medication, and you would move this around for each multi-dose injection you would take. This area here, you move the injection around in the top thigh or even in the side outer thigh. So I always get asked a question of, if I use my belly, do I have to stick with my belly? No, you can use belly and add in the thighs. You could do just thigh and no belly, or you could do a combination. And whichever way you choose to do that is perfectly fine. It's A-okay usually, but your nurse will certainly guide you too as well with where the sites are. But the thing about a shot that's happening for more than one time, it's always making sure that the patient's moving it around from where they gave it previously. If I were to give this person her injection and she were laying down, I would have her lay on her back, and this injection would go in at a 90-degree angle on the belly, would be a 90-degree angle on the top of the thigh, and a 90-degree angle into her side thigh. Because you can also self-inject though, if she's standing or sitting, this would be the position of her body. So if her position of her body is that she's standing and sitting and self-injecting, the angle of the needle is going to just go straight in. And a big question I always get asked with the shots is, does all the needle go in? And you actually really do need to make sure with this one that all the needle goes in, because you're really only putting in a 1/2-inch needle. And we all have, as you can see, I'll just show you this on this mannequin, we all have this yellow area, which is fatty tissue, and it's usually more than a 1/2 inch. So the idea is that's why we're picking these areas that have good fatty tissue for you to use, but it's very important to get it all the way into that area, okay? So one of the things that you'll want to do is make sure that you clean the area with alcohol. And one of the next steps we do is we uncap the needle. We give a little pinch to the skin. So what I'll show with my arm is that when you're pinching the skin, you just don't want to pinch too hard and squeeze too hard. You could get bruises. And if you get bruising, it occasionally happens to people when they get blood drawn or shots given. It's A-okay. You just want to make sure you don't administer another shot in a bruise. If you get a bruise, let it heal. But the key is sometimes if I see somebody that might have multiple bruises, I might have them show me the technique of their pinching, just to make sure that they're not pinching too tight. So it's really just you're lifting the fatty tissue up off of the muscle, so it's a nice, just gentle lift. I like to kind of think of it as a lift versus a pinch. So we're going to give a little lift to that fatty tissue. We're going to angle the needle straight in, and we do not need to jab. okay? No reason to trauma the skin that way. Just place it gently to the skin, give a little pinch. There's where you will feel your mosquito bite. That's exactly what it feels like when those little needles go in, is a little quick mosquito bite. Now you don't even feel it. Then we press that fluid in there, and with multi-dose, you probably will not even feel that medicine go in. Most patients that I speak to after I've taught them their shots, they'll say, wow, I was really surprised at how little you said I would feel, and I actually really didn't feel anything, and I thought I would feel a lot more. And that makes me happy, so that it reassures them and reinforces what we're teaching. And then when you remove the needle, you can do a little 1, 2, 3 count, move it gently, set it down, and then you'll put a little pressure there, just to, if there's any fluid that's moving, you want to keep it in the skin for it to absorb. And you also want to, stop any little bleeding. But usually, like a mosquito bite, you might get a little bleeding from these little tiny shots, but not much at all. With that multi-dose, the key thing to know is after you give that injection, what you are going to do is then put your vial in the refrigerator. And then on your next injection, what you can do is take it out. You could leave the vial on the counter for a few minutes, or you could draw up your dose and leave the dosage, just what you need, out on the counter for a few minutes using the several syringes that you have. Because remember, it's a multi-vial dose, but you have many syringes so that you can do more than one injection. Once this vial is empty, so say you end up having a dose of 150 and you draw up 50 from this one that's just has 50 units. So draw up the 50, cap the needle, open up your new box, mix that vial with the one syringe that has the liquid in it, mix that vial, let it settle, and then take your syringe, clean the top of that vial that already has the 50 in it, and draw up the remainder 100. So you might be using 2 separate vials, one vial that had 50 in it and a brand new one that you were able to draw up the 100 for your total of 150. So it doesn't have to be 2 shots. It can still be just that one injection. But when the vial's empty, it may not be able to give you a full dosage. So that's when you mix a new vial and draw up to the rest of what you need that equals 150, okay? So I hope that video helps you to understand the multi-dose Gonalef product, and best of luck with you in getting started on your injection journey. Part of your medication cycle, and gave you some tips with that one. And Craig, if you have any questions for me that I can help answer, I will do that.
Sounds good. So this one may have come in right before while somebody was watching the video, because you did mostly address this right towards the end there. But the question was just around what should I do if I do not have enough left in a vial for a complete shot? And the question's obviously around taking that second shot, which you did touch on. Is there anything else that you wanted to add to that here?
No, just to reinforce, hopefully, that although sometimes people hear that drugs need some mixing or the fertility medications need mixing, hopefully, as that video had shown, it's really maybe a couple steps, but nothing that's too difficult. And like I said, if you're able to put a recipe together and follow directions and have ingredients, you're able to do that with your supplies and your directions like this video with these mixing medications.
Perfect. That is an amazing, way for people to view it and to get more comfortable with the entire process. So we may be stealing that and using that again, Wanda. Thank you very much.
All right.
A question that just came in, this is from Nicole, actually on Facebook, said, are there any prenatal vitamins that should not be taken with these meds?
You know what, that would be something you would want to ask your clinic. I mean, most often every patient, we try to encourage them to have good, proper vitamin and minerals prior to pregnancy. So the benefit we have as fertility clinics is we're seeing you preconceptually. So it's always great to be able to have this discussion with your physician. And most often there will be a prescription that is given even prior to you starting the cycle and wanting you to take your prenatal vitamin before these medications begin. So oftentimes, no, there isn't a typical conflict with the injectable medication and your prenatal vitamin. it is a part of a conjunctive therapy. It's something that we want you to be on the prenatal vitamin along with your treatment, because like I said, that's preparing you for pregnancy. So the fertility cycle is going to hopefully get us to that place of being pregnant, but we can preconceptually get your body ready and get those nice minerals and vitamins. So, you know, they work together, the fertility medications and getting you ready for pregnancy. So usually you can take your prenatal vitamin. But if you have any questions or concerns otherwise, you know, if you're on something, by all means, you know, direct that to your clinic, to your nurse.
Absolutely. Thank you. And that's also obviously something that the pharmacy specifically can help you out with that as well. So you can always reach out to the pharmacist at Mandel's. We are able to answer some of these questions and talk to some of these potential conflicts that may be occurring. So it's a great way to understand that there is a you know, multiple different people here that can help you through this process, and you don't have to feel like everything just has to be you wait for this program. You can reach out to us and we can walk you through some of these things as well.
Yeah.
One other quick question that did come through, and so this is from Jessica, who I know you touched on it a little bit on the last when we were talking about the pen, but she got here a little bit late, so she just wanted us to see if we could touch on, do you recommend ice before the shot? And she just wanted to kind of know, would that help with potentially with pain or anything like that?
For the next medication, which is a great question from, I think you said Jessica, we're going to be going into a type of a patch that's a numbing cream type of patch that you could potentially ask for from your clinic and talk to your nurse and see if they could order it through a pharmacy like Mandel's Pharmacy for this, the specialty pharmacies for your fertility medications. But check in with your clinic as well. I mean, we do give instructions sometimes that some medications you can utilize a little ice before. For the ones that I just have gone over that are subcutaneous, oftentimes, as I sort of mentioned in one of the videos, is that the medication's going into a very small amount of a body. It's going in only a half an inch. It's getting into that fatty tissue. And even though you do have little threads that are like little capillaries that are delivering that medication to where it needs to go, so those are very tiny. And so when we put ice on something, we constrict blood flow. So with those little injections, sometimes we might refrain from using the icing, but the Cenera that I'm going to have in the next video, which is a patch, you could possibly use that as a numbing agent to help you a bit if your clinic is okay with that. So you would check in with them. Intramuscular shots, which are seen at later videos or even some of the earlier videos, we sometimes let you use a little ice for that because those are going a little deeper and those are getting into muscle. So really what you want to do is numb a little bit of the surface, which is fine to do that then when you're doing intramuscular because it's being delivered a little bit deeper in the body and into the muscle, very vascular tissue. So certainly always ask, you know, your nurse and your physician what they recommend. But on this video, one of the products that I will be reviewing next is a product that can help with blood draw if you have issues when you get your blood drawn in numbing that area or numbing the area for you with your injection for either shot, actually.
Thank you very much. Okay, so we have a bunch coming in right now. So let's see, from Latoya, we have the question. She says, I am currently on the second day of my cycle, starting the Gonalef tonight. Would the medicine affect my menstrual cycle?
Good question, Latoya. Actually, it will not. The cycle that you have right now is preparing you to start your medication, so you are exactly where you're supposed to be in terms of a lot of times when women are starting these cycles, so it's a really good question, actually, is a lot of times when you're starting these medications, whether it be for insemination or IVF, you will potentially be the second or third day of your period. So absolutely, it does not affect the bleed. It won't make it less or more. This is just when your body is at what we call a baseline. All of your hormones right now are at a baseline level, and that's what your center wants them to be prior to you starting the medication. So will not have any impact on that period. So good luck with getting started, and I hope that either of those videos for you for the Gonalef and you were able to see them will be of help.
Perfect. Thank you so much, Wanda. Okay, so right now we are we've handled most of the questions coming through. There, it looks like there's some other things that are being typed. So if they pop up and they're not something we've already touched on, I can jump back in and get to those. But if you want to give people a couple seconds, if there's anything else you wanted to share before we move on to the next product. And again, remember everybody, you will have a chance to to ask any questions about all three of the products at the end. So don't feel like you have to you have to start typing in shorthand to get it in time. Wanda will have more than enough time to answer all of your questions.
I think I would want to add, because I'm going to go, the next product is the Sonera lidocaine patch. So what I want to mention is, that is something that might be of help to you, but you can talk to your clinic, as I mentioned just a few minutes ago, about the icing and which areas they're okay with you icing, because ice is a nice, quick, easy way to numb an area before that needle might go in. But one of the things I want to emphasize is I've taught a lot of patients in person, a lot of couples with these medications, and I want to give you guys the confidence that a lot of people get back to us or have said to me, thanks so much for the teaching, thanks so much for the instruction, but more importantly, you really put me at ease with not worrying of how it was going to feel. Yes, I felt a little anxious getting started, but that after I did the medication, it wasn't quite so bad. So I really, really want to kind of send home that message tonight that most of the medications, that even though they're injections, and we're certainly not trying to belittle that fact, we just want to let you know that most often patients really are able to do very well, get through their cycles. And as I said in the one video, there's a start and a finish. It's not a forever thing. Just for the time and the duration that you do your cycle, that's when you're on those injections. But again, it's a start and a finish, which is nice, so that you know that there's an end in sight to them. And even during them, when you are taking them, most often everyone is really amazed at how much little that they felt that they thought were going to feel a lot, and they really didn't. So that just makes me feel good that it reinforces all of that we're trying to get that point across.
Thank you so much. I want to thank everyone for making time in your busy schedule to spend it with us this evening in the PharmAssist program. I specifically want to thank all 4 of our nurses tonight. We had Karen, Caitlin, Laurel, and Wanda, each walking through one of the different products from their previous presentations from month 2 of the PharmAssist program. So with all that being said, I want to say thank you so much for coming in and listening to our questions, for providing those questions the first time around. Any questions that you may have, even though this is not a live program, you can post it up on the Facebook page, and we will definitely get back to you and answer you. I want to remind all of you that all of these full virtual learning experience videos, or VLEs as we call them, are, as well as the individual product demonstration videos, are all available on demand at our YouTube page, our Facebook page, and on our homepage, mymandelsPharmacy.com/PharmAssist. We look forward to seeing you here, typically, again, every Monday night, typically live. We will be returning with our next live installment after Labor Day, but it's Monday night at 7 p.m. is our standard PharmAssist night, and we look forward to seeing you there for another great program. Please share the PharmAssist program with anyone that you think can benefit from it, friends, family, anyone else, other friends of yours who might be going through a similar circumstance like this. But we really do appreciate that you share this information so more people get a chance to benefit from it. So thank you so much once again. Have a great evening, and we will see you again live when we return after Labor Day with the live PharmAssist virtual learning experience program. Thanks again. Have a great night.